treats back pain? I saw this online and I looked up to see who exactly does this. Hi guys, thanks for tuning into my channel, Healthy Pet Girl. And my name is Kamala. Yes, that's my real name. And today we're going to talk about who treats back pain. I saw this online and I looked up to see who exactly does this. So before I start, just want to say please press the thumbs up and like this video. So the first one up is what most people normally know. It's the PT, the physical therapist. And they normally are referred by your doctor. They are actually doctors themselves, and they help you with, any injury, illnesses that cause you to have a limited mobility. They help you with manual movements, exercises. They use machinery and equipment to help you your um, regain your mobility, and they go through a whole plan with you. They look through your history and they plan how to help you to reach your goal as to, helping you with pain and mobility. The other specialist is a chiropractor. They are doctors and they usually manually manipulate your body, your spine, and they try to get you to be realigned. They go through your history, they plan how to help you out, and while they are, manually twisting and turning you, they're using force to get your bones to, pop and move into certain positions. And, there have been cases of people actually feeling worse after having to go to the chiropractor. So use your judgment and figure out if that's one of the specialists you would like to see to help you with pain. Chiropractors also give you injections, so I guess that helps you out with your pain. And it's basically temporary. So it's temporary, so you will most likely have to go back and see them to get another injection, which to me, I am not really into things like that. Okay, and next up are physiatrists. They usually help you out the same way, with your pain, injury, illness. They come up with a plan by going through running a lot of tests to see exactly what is happening with you. And they usually have like a whole body approach, which means they check top to bottom and they see if you need to go to other specialists. They might refer you to like a psychiatrist or actually like a physical therapist. They will refer you to different people depending on your needs. And they also go through, what you need to eat, what you need to do at home. They are very basically dealing with the whole body. Personally, I like the whole body approach. The whole holistic approach is how I see things, and usually that's how I was able to fix my back problem. So next up are rheumatologists. They usually treat problems in the joints and the bones, um, and they are referred to you by doctors. They also make referrals to other specialists, in case you need surgery or something like that. They might also give you an injection for pain. They usually run through a series of testing to see where you are at and what goals they need to set for your treatment and for your recovery. Next up is a neurologist. So neurologists usually run a series of tests. They basically look at you to see how you are, like your movements, your five senses. They're just like looking at you to see if, nerves and everything are processing your stance. So they run through your medical history, they check all of that stuff, and they come up with some sort of plan. But usually what they generally do is just basically kind of push you off to somebody else. They refer you to a surgeon, they refer you to another specialist. In my opinion, neurologists don't really do much. I've actually been to one to figure out what was going on with my back. And, I spent like 10 minutes in the room talking and basically nothing. All they could tell me was, okay, they can't do anything for me. So those are neurologists. Okay, next up, occupational therapists. Some are doctors and some are not. And it all depends on what they want to do, where do they go to school, and how far they want to go. So these guys, they help you at home, or they go to schools or your job, and basically they run through your history. You know, they talk to your doctors and they talk to you to come up with a plan to see how you can better do activities. They figure out when you're at home what it is you need to do differently. When you're at school, work, what are some of the activities that you have to do differently? They also show you how to use different tools that you need. Like, for instance, if you're using a cane, um, they just run through everything with you. They do show up to your actual site where you are at work or home, and they will go through, you know, basically what you need to go through your life, you know, any activities and anything that you need to get done. They show you another way to do it safely. The occupational therapists usually help you deal with your disability or limited mobility, injury, things like that. What I want to say about all of these specialists is that they are very helpful when you're new to chronic back pain. So it's a good idea to go see them, but after a while the costs do add up, and eventually you will have to keep going to them over and over because you're just not going to be better after one visit. So what I eventually did was figure out a way to do this on my own and get myself together. I used nutrition and I got my mindset together, and I figured a way to build up the strength in my back and my mobility. Um, and it did take more than a year, I would say probably a year and a half to two, before I felt more normal and I wasn't having like the chronic pains. I was able to control how I felt, and yeah, pretty much developed a routine how to do that. I was diagnosed with degenerative disc disease, so I had lower back pain and I had sciatica. So if you need help with your back pain and figuring out a routine, then a comment below and I will help you out. And so that pretty much sums up the medical professionals. And in my next video, I will talk about, you know, alternative specialists that are not necessarily doctors, and they also help you with pain. So stick around for that. And, you know, I have more stuff. So watch out for more videos. And please look at all my descriptions in the below for all my offers. And please like the video and subscribe because, like I said, I have more stuff. There are also chiropractors, and that's basically it.